I'm Dr. Maqbool Ahmed. I'm a hematologist oncologist. I've been working here in Evansville since 2001, and I basically deal with all kinds of cancers, blood disorders, and basically general medical oncology. So a clinical trial is when either there is a new drug which has not been used in humans and that is being tested for the first time, all the way up to established drugs which have been used purely from a cancer point of view in different cancers, but are being either tested in this new cancer indication and compared to already established drugs. So this is a broad category of what we call clinical trials. It basically means to experiment on a known drug or a new drug. Well, for many reasons. Number one, what we consider now as the best treatment option available was once upon a time a clinical trial. So there were patients who participated in the trial, took their chance, and came ahead with this new treatment, which we would consider to be the best treatment available. So there's always, every drug which is approved today was once upon a time in a clinical trial. So your next best treatment tomorrow may be in a clinical trial today. And then there's more science behind it, where newer ways of attacking the cancer cells, those drugs need to go through a clinical trial and then prove that they really make a difference in the outcome. And tomorrow they become available for everybody to use it. But today they might be in a clinical trial. So that might be your best opportunity to look for what we call a novel or a new treatment, which might be game changer in certain cancer. Of course, we recommend that you should work with your physician or your physician's assistant to find the best clinical trial, because the clinical trial information changes basically on a day-to-day basis. A trial available today may not be available next week, and a trial which is still in the works may be available next week. So when you're ready for a trial, I think it is best to work with a physician and do your own research as well. There might be something you find online, and there is a very good website which I use. It's cancer.gov, and then you can go into the clinical trials section in that and look for a clinical trial, and then most importantly discuss with your provider and see if that trial is right for you. So the results of clinical trials are measured pretty much similar to what we normally do. Usually, if a patient has a lung cancer and is enrolled in a clinical trial, we will repeat a CT scan every 2 months. That's what we normally do in normal practice, and which pretty much a clinical trial would also want to repeat a scan in 2 months to see the progress of the treatment. So they're pretty standardized, similar to what we call usual practice. So we like to say standard of care means that overall care would be seeing a physician and having all the blood work done and the imaging done would be pretty much what we consider an appropriate standard in United States medicine. So patients in clinical trial will get at least that level of care, if not better. And they certainly, we feel that in most patients' clinical trials, patients are monitored very closely, and even more closely than they normally are done, for any potential side effects. So I personally believe that the care given during clinical trial is even higher than you normally receive in a doctor's office. So we basically divide most clinical trials into 3 phases. Phase 1 is when it's a totally new drug and we want to know if it is safe for human consumption. So basically patients are started on a very small dose, and then the dose is slowly increased and see if they're tolerating the drug or not. Our interest is not to see if it is effective against any particular disease or not. So patients with different kind of cancers might be enrolled in that clinical trial just to make sure that this drug is safe for human consumption. Phase 2 is where we think a drug is safe to use and it is being used in certain different kinds of cancer to see if their cancer responds to this drug or not. And that's a phase 2. Very commonly, most drugs come out from phase 2 and they go into phase 3. In phase 3, we already established in phase 2 that the drug is, say, effective against, say, lung cancer. And in phase 3, we will compare this drug to what we already know is the best lung cancer drug for that scenario, and then compare this drug, which has just passed the phase 2, in the phase 3 with the standard drug and see if it is equal or better or not than what we already know is the best treatment available. So that's the final phase called phase 3. And just remember, before phase 1, almost all of these drugs have been tested in animal models to make sure that there's no significant risk of kidney damage or liver damage. But animal studies are limited, so humans really are the next step after animal studies prove that these drugs are relatively safe to take. We don't think there will be extra cost. There will be usual cost. Many clinical trials may supplement patients even for travel time or lodging, depending on the clinical trial. There may be still, during a clinical trial, there are some things which we consider standard of care. So those may be billed to patients' insurance still. For example, a patient with lung cancer needs a PET scan or a CT scan, which would be required to enroll in a clinical trial. But since it is considered standard of care to have that as a baseline, so that can be billed directly to the patient's insurance. So we do not think that there would be extra cost in a clinical trial other than usual cost of having the treatment for that particular disease process. It's quite possible that during the terms of the trial, you may be seeing another doctor, which could be at a different university center. So temporarily, you may have to be under the care of the other doctor. And when the trial is over, then certainly you can resume care with your own regular oncologist. No, actually, that's a really big misconception. We think even clinical trials could be a useful thing if you have access to a trial and are willing to go for a clinical trial, which mostly in our size city would require a person to go to a larger facility. But we think sometimes clinical trials would be the best option in the first line treatment for a patient. So certainly clinical trials should always be considered even at the time of diagnosis and see if a patient will be best served in a clinical trial rather than going on the standard of care. And if I'm a patient, I will certainly explore all the possibilities of clinical trial, see if there's something really new drug coming out, which might be in different phase of clinical trial, which might be the best way to fight a cancer rather than going on the standard treatment. Because you always have the option of going to the standard treatment if you do not qualify on a clinical trial, or if the clinical trial drug does not work out for the patient, they can always really go back to the standard treatment. So it really does not prevent you from receiving the standard treatment afterwards. So we think that the best option for every patient is to explore the possibility of a clinical trial, whether that's a newly diagnosed or whether that patient has exhausted all their standard usual approved treatment options. Well, that is very important. Yes, and that is not just a concern for the patient, but also for the clinical investigator or the team, because whenever they're testing a new drug, they are very, very focused on any new potential side effect. Because remember, when a drug is approved by FDA, they don't just look at how well the drug did in shrinking the cancer. They also look at quality of life and all the side effects. So if a drug looks very good in shrinking the cancer, but hurting the patients physically, that drug may not get approved. So they are very vigilant about any potential side effects on a new drug. So usually patients are strongly encouraged to report any change in the quality of life and any new side effects, and they really take these things very seriously. All these treatments, which we consider to be gold standard today, were once upon a time clinical trial. And a trial may be a successful trial, in which case the patient likely may have benefited or somebody would have benefited. And this is how the science develops. If nobody participates in a clinical trial, then we will not have new drugs approved, then we will not make any advances or any progress in science. So that's just the way the humanity rolls.